Hello, welcome everyone who's joining. All right. Shall we get started? Are you ready, Chanda?
Yeah.
All right. Well, welcome everyone who joined us tonight. Hello, Elena or Lana from Long Island in New York. We have Carrie from Chicago. Welcome everyone to the Backbones Women and SCI Health Talks tonight. This program is funded by the Christopher and the Dana Reeve Foundation. My name is Rebecca Torres, and I'm the founder and the executive director of Backbones. And today's webinar topic is on preventative health with our guest, Chanda Hinton. We've been, some of you registered for this back in February, and we had to reschedule it. So I'm really happy that we were able to make sure that we brought this topic to all of you, because it was one that everyone was really interested in and requested. And we all know that living with spinal cord injury and a disability requires some maintenance and care of our bodies and minds. And so today we'll be talking about preventing secondary conditions and also some of the work that Chanda is doing, and then massage and acupuncture, yoga, other types of things that can help us with our wellness and quality of life. This webinar is recorded, and so it will be sent out to everyone who is registered, and it will also be uploaded to our YouTube channel, where you can also find other past webinars for this. I'll be posting that in the chat as well in a little bit. If you are new to Backbones, our organization is committed to helping people with spinal cord injuries and similar disabilities and finding connection and community. And we do this by hosting events, both in person and virtually, facilitating one-on-one peer support, and also providing resources to individuals with spinal cord injuries and their family members while they're trying to navigate life post-injury. I encourage you all, if you haven't checked out our website, to do so at backbonesonline.com and see how you can get involved with some of our programs. So this particular program, the Women Health Talks, is a community-led program that seeks to bring awareness and education about women's health in the context of spinal cord injury and disability. And our topics and our format were the result of 2 community listening sessions where women with SCI from across the country provided some insights and feedback. And so we will continue to ask for feedback, to be community-led. And also tomorrow, when you get the recording, we will ask that you fill out a short survey. It's very short, it's 5 questions, and it just really helps us give feedback about the program. And then before we get started, just a couple more things. In addition to this recorded webinar, we do have a private group that's just for women with SCI, a small discussion group to unpack the conversations that we talk about every month. So it's private and it's small, and so it's a safe space for women to share and discuss. If you're interested in that, I will be adding that to the chat shortly as well. And we do have a 10 to 15 minute Q&A at the end of this. So feel free throughout the session to add your questions to the chat, or you can save them at the end and we will unmute you. You can raise your hand if the chat isn't accessible to you. You can do raise hand and we can unmute you. So it is my pleasure to welcome Chanda Hinton, who is the executive director of the Chanda Center for Health and Chanda Plan Foundation, which provides access to holistic, collaborative, access and disability competent healthcare programs to individuals with physical disabilities. And in 2009, she led the movement to pass the Colorado House Bill 1047, which created the spinal cord injury waiver, offering acupuncture, massage, and chiropractic care through Medicaid to evaluate cost effectiveness and improve quality of life for persons with spinal cord injuries in the Denver metro area. Amazing. And in 2021, she expanded these services legislatively to other diagnoses and to be a statewide benefit. So I can't wait to hear more. I'm sure you all are waiting to hear from Chanda. Welcome, and I will pass it over to you. And I will come back at the end. I'll be collecting some questions and I'll pop in a little bit. So I'll spotlight you. There we go. Oh, you're muted.
Thank you so much, everyone. I'm gonna just pull up. Can you hear me? Can everyone hear me now? Thumbs up, everyone. Yay! I loved all of the people saying hello from the various places. So thanks for being here. And I'm just going to share my screen because I have a PowerPoint that I do want to just kind of go along with the conversation to support us in keeping on track, because I know as a woman with a spinal cord injury, when it comes to healthcare, I want to talk about all kinds of things, and I can get pretty far in the weeds. So I am excited about the topic. It's a topic that I have a conversation with all sorts of individuals every single day here at the Chanda Center for Health, and I'll get more into those pieces of it. But I know that when I was asked to be a part of this, which I love so much, I love Backbones, and I really wanted to share this education and conversation to women, you know, across the country. So I just love that this is an opportunity for all of us to have more education and a conversation at the end as well. So I just wanted to share, I know that there's already a great overview that the Chanda Center, our mission is to deliver, advocate, and educate for integrative health, primary care, and other complementary services to reduce healthcare disparities and costs by improving health equity and outcomes for individuals with physical disabilities through donors of the Chanda Plan Foundation. So that's kind of a mouthful. You can see that there's very specific keywords in there around improved health equity. Outcomes is critical. And we, even though we say physical disabilities, currently our population is around 90% of folks with spinal cord injuries. I'm gonna go to let me just open this up here. Full screen, right? There we go. So I don't really need to introduce myself again. So I'm just going to go to the next slide here. And
Chanda is showing your presentation view.
Oh, really?
Yeah, like your notes.
Oh, I think that's just subtitles. Do you see the subtitles?
We see the subtitles, but we also see like your next slide on the top right. Yeah.
Oh, goodness. How about that? Is that same or no? Different?
It's the same.
I'll go back to the old one.
Okay.
Y'all love technology, right?
Yep.
This one's fine. We'll just keep it at this one.
Yeah, that one's large. We can see.
Yes, that's large and everyone can see it. So disability and wellness does coexist. And so this is the conversation that I want us to have as women tonight and with spinal cord injuries. And I think that disability and wellness, if you think about it, those are two polar opposite terms that a lot of individuals don't believe even belong together, right? Because we are women that live with spinal cord injuries. And so we don't look, I don't look at my disability as this like condition per se. I look at it as it's a new type of lifestyle. Oftentimes in the world, the perception is that when you look up the definition of disability, it doesn't represent what it actually means in the world today. It's actually, I didn't want to bring out the definitions because the definitions are not very accurate, very aged, and was not something that I wanted to do. But I think that a lot of people in community, even those with disabilities or not, they have a hard time with the concept that disability and wellness can coexist. And so often that comes from just how healthcare has been looked at as in general from the medical model. It's how we've addressed our spinal cord injuries from the past. And then I think it's as we've evolved over time with medicine and integration and having more voices, we start to we're able to stand with truth around that disability has the ability to live within wellness. And granted, we're always going to have stuff that come up, right? We're going to have urinary tract infections. We're going to have the various things that we have to address that are ongoing and conditions of spinal cord injury, but it doesn't mean that we can't live within wellness and sustain that wellness so that we can have the best quality of life. So I just wanted to kind of start with a question, and I don't know if we can put some words into chat here, and we can kind of reflect on them later, but you know, I asked the question, how do we perceive our healthcare? So just for a moment, I want each of you to determine, kind of think of your own healthcare as of right now. Does it feel, do you feel healthy living with a spinal cord injury? Like, how are you perceiving your individual health? And if wellness was over here and poor health was over here, where do you think that you live? And then what kind of stories also within there do you add on? Well, yeah, I'm well, but blah, 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 right? So kind of think about that for yourself and put some things in the chat that you can share about how do you perceive your own health. I think because first of all, how we perceive our own health is really how then it gets carried out in our lives and how we become advocates for our health, or if we fall into the perceptions that are of others. And so, for example, there was a study done with physicians, and one of the questions that were asked to the primary care physicians is that, do they believe that people with disabilities could live a healthy lifestyle? And 90% of those physicians said no. That was extremely telling for me from a medical perspective. A primary care physician, their perspective is that we are not healthy people. So that for me was a red flag when I was looking through the study. This was done at the Anschutz, University of Anschutz campus here at Denver, Colorado, where they look at disability competent care. And one of the ways of looking at disability competent care is if you're not getting disability competent care with your primary care physician, it's if they don't believe you have the ability to be healthy, what are they going to represent to you as ways of sustaining wellness? They may not represent or share anything because they have no belief that that's even a possibility. So I want to also just express, it's not only how we perceive it, but it's how other people perceive it. And sometimes when we're newly injured, we can take on the perception of others when it comes to identifying what our healthcare looks like, our individual versus our collective as a community. One of my philosophies around healthcare is that, you know, I always talk about this in between, because I feel as though individuals, we after our injuries, we go from no ability, and oftentimes in the very first part of our injury, we're always thinking about how do we get back to full mobility, right? Like, how do I walk again? How do I become what I was before? And so as a woman that's lived with a spinal cord injury for 31 years, and being around a lot of advocates and organizations that raise money for a cure, which I support, I know that I represent the conversation about what are we doing with our bodies between the time of injury and if there is, you know, some sort of magic, you know, a cure for spinal cord. And for me, it's the true belief that the in-between is what really counts. The perception of how we look at our own health, the perception that we take on from others in this in-between place is that if we can sustain our bodies the best during that time, we are going to be, that's what's going to be most successful for us in terms of having an improved quality of life. And if we don't take care of our bodies, if let's say tomorrow there was something that said, something came around that said there's a cure, will our bodies be ready for that? And so I don't focus on that component of healthcare, but I like to point to it just because I know that there is a broad or a very vast spectrum of where we're all at in our spinal cord injury in terms of how many years we've had a spinal cord injury. So I think that it's important to address that and share that and just share it as a philosophy. You may or may not be 100% in agreement with it, and it's okay. You'll also notice that the in-between is very squiggly. So this is not a linear model. So for example, I find that my healing process and maintaining my healthcare is constant. It's something that I have to work at, and that the benchmark can change from time to time. And so while it's not linear, it's always progressive, and it's up and down at times. And for me, it's just being aware of my goals at that given time and how I'm being able to be a participant in community. Am I able to be active with my family and friends? Am I able to be employed if I choose to do so? Like, am I able to have a fulfilling life because I'm sustaining my wellness? And from that, I'm able to do the things that I desire in life. So before I get into this particular slide, which talks about how we kind of structured looking at therapeutic, accessible, and disability competent care from a service and an environmental perspective, is because my personal story. I'm going to update that too. And so for my personal story, I just want to share that with you, because I think that from there, it really drives the rest of the conversation in terms of knowing why I chose to do this type of work. So when I was 9 years old, I was accidentally shot in the back of the neck. It severed my spinal cord between C5 and C6. And so I was very young. I lived in Nebraska, a very rural community, and I was the only one with a spinal cord injury in that community. My primary care physician had never taken care of anybody with a spinal cord injury before, not let alone anybody maybe in the more larger city close to the small town that I lived in. And so for the majority of my life, which some of you can relate to, is that I was, hey, here's your spinal cord injury. You went to rehab. We've given you all of the medication associated to your spinal cord injury around your bladders, your bowels, your muscle spasms, your pain, you name it, right? There was always, that was kind of like injury, rehab, medication, go home. And there was nothing around proactive, ongoing, and preventative care, nor was it funded, because at a certain point, funding would be cut off. So what I did is I sat in my wheelchair and I consumed a lot of medications. I didn't move my body. I didn't stand in a standing frame. I was in a rural community where they didn't even know what a standing frame was. They didn't know all of the technology and all the movement that we have in communities now. Like, they didn't know any of those things. So when I turned 21, I started having really severe chronic pain in my lower back. And so I went to the physician. At this time, I had moved out to Colorado. I did my undergrad at DU. I was in college when I started to have this severe pain. And also note, between that time of being injured, rehab, on medication, and just sitting in my chair, I had a lot of sickness. I would have pneumonia almost every year. I was in the hospital probably every quarter with urinary tract infection. So I was pumped with a lot of antibiotics. And there's no one, for me, I don't blame anyone. I'm not upset with anyone, because we were just doing what we knew to do, right? And so when I moved out to Denver, I started to have this very severe chronic pain in my lower back. And so I went to the primary care physician, and when I was there, he's like, oh, didn't you know that chronic pain is a part of spinal cord injury? Like, we're gonna write you a script for Percocet. Well, again, very naive, nothing outside of the traditional model, I started to take Percocet. And at this time, it was 2003, which is actually when the opioid epidemic was at its highest peak, where it became very easy to get opioids in community. I had a very good reason to have it, is what I thought. And I became extremely dependent on it and became very addicted to it. I was on 4 Percocets a day. I couldn't get out of bed. I got down to 59 pounds. And then that's when my family basically kind of intervened and said, this is not life. We need to figure this out. First of all, I needed to be hospitalized and have a medical intervention to actually save my life. So I had a feeding tube put in. I was being fed intravenously, and then I was being detoxed from all of the opioids. So that was about 60 days in the hospital. And from there, my physician, the medical model brought me there. The medical intervention saved my life. And then my physician said, hey, you're good to go back and live life and do what you were doing before. And that's when my sister, who was a yoga instructor, stepped up and just said, hey, why don't we redefine the way that we approach Chanda's spinal cord injury? And for me, still being probably in my 20s, not aware of what she was referring to. And so she started saying things such as acupuncture, massage, chiropractic, physical therapy, like the things that your body that our human body needs in order to sustain wellness. But when we have paralysis, how do we access those, right? Can everyone, or did I slow down a little bit right there?
You broke up a little bit, but you're back.
Okay, good. Perfect. So for me, it was all about, looking at how do we sustain the things that we can no longer do with no movement to our body. And I came back to Denver and I started participating in those services. And I'm in this conversation with you all tonight because, and I tell this to everyone all the time, that I am here having this conversation because of integrative healthcare, because of those services being brought to my attention from actually trying them. And then beyond that, for advocating for them. Because right after that occurred, I knew that I had to make this available to other people. And so that's when I started the Chanda Plan Foundation and the Chanda Center for Health. So that way I could not only advocate on a legislative level to make Medicaid cover these services, but fundraise so that when people weren't eligible for that, they still had access to these services through donor dollars. And all of it with very specific, not only from the service side, the therapeutic and accessible and disability competence, meaning that I'm going to show you a video which is going to bring out some of those pieces, but we have structured it all the way from service and making those services available, but then also the environment to make it available. So when now let's go to the video, and when you see the video, you'll be able to really see how all of these particular things play out within services and environment when it comes to therapeutic, accessible, and disability competent care. Can you guys see the screen with the YouTube on it?
We can only see your slide that says video.
Can you see this?
Yes.
Okay. And if everyone has volume on their computer, I can control it to some degree over here. So I'm going to go ahead and play this.
Serving our community for nearly 2 decades, the Chanda Center for
Oh, when you mute yourself, we can't hear it.
by generous donors of the Chanda Plan Foundation. Navigating accessibility daily can be exhausting. However, at the Chanda Center, we strive to reduce barriers that can prevent someone's physical ability or emotional desire to access healthcare. As a leader of service and change for individuals with long-term physical disabilities, we offer acupuncture, massage, chiropractic care, yoga, care coordination, counseling, primary care, dental services, and more. All these services are provided through a lens of disability competent care that is made evident through our provider and staff culture and accessible features. We want to see the faces of those we serve. At the Chanda Center, there is no waiting behind a tall counter, which creates a feeling of being invisible. With behavioral health services, our participants have space to exercise the mind, as well as process the trauma they may experience day to day. Less than 20% of the health clinics and hospitals offer a wheelchair scale, leaving a large population not knowing their own weight. Given some medication dosages are determined by weight, accurate information is essential. We take pride in this accessible feature. Our treatment rooms continue to offer the same level of accessibility that participants experience when arriving and entering the Chanda Center. The rooms are designed to be practical, accessible, welcoming, and trauma-informed. All our treatment rooms have height-adjustable tables to help with safe transfer to and from wheelchairs. For participants who need more assistance, there are sliding boards in each room, and most rooms also feature a ceiling lift. We have also equipped each room with voice-activated call systems so that each participant can call the front desk if there is an emergency or listen to soothing music. Primary care should be accessible to all, but unfortunately, it is not. With support from community partners, we offer primary care in a setting that makes health equality a reality. Our yoga room is a multi-use space. We offer adaptive yoga, of course, but it is also used for physical therapy, lectures, and education to participants on a variety of topics. Without movement, individuals with long-term physical disabilities experience more loss of movement or result in increased pain because our bodies are meant to move. Our T-Bar offers a place for participants and caregivers to plug in or eat lunch in between services. It's a space for participants to wait for transportation as well. Most importantly, it's a place for connection to build camaraderie, share resources, and laugh. All providers have a shared office with the philosophy that collaboration for those we serve makes a significant difference in their services. As a bullpen of resources, internal community, and brainstorming together, our team can get ahead of participants' health needs. Grants, individual donors, and events make all this possible. Give today so we can sustain our programs and serve more.
Let me exit out of this and go back to sharing the PowerPoint. So that was just an overview of, can everyone now see the slide again? Or, okay,
Yes.
great. So that it kind of gives an overview of where, when I looked at my own situation and I did some, research, I found out that what I was experiencing wasn't isolated to myself. It was a common issue for folks with spinal cord injuries, where accessing that preventative care. So while I looked at it from a systemic level, like I said, mentioning I wanted to get Medicaid to cover it, I also wanted to look at, well, if Medicaid covers it, what kind of services does it need to cover? One, what about the services it doesn't cover? But then also what kind of environment and humans need to have this level of education around a population that really deserves to be able to have folks work on them with understanding and respect. And I think that there's so many barriers in community where that environment or that very, like I would say, architectural component of just the bathrooms, everything accessible, it makes people feel welcome and go to healthcare rather than run away from healthcare. I think that if we hit healthcare barriers one after one after one, who makes us want to continue participating in healthcare if all we do is hit roadblocks when we're there as women? I would say that another component of healthcare when it comes to women is I have, with our primary care, we have been really looking at how do we actually get mammogram machines where we can will up to them closely and that it's within our community. There is not one provider in the Denver metro area that is providing that type of service to women with disabilities. I remember there was this mammogram image of this mammogram up here with all of these steps, and it was showing a metaphor of and a woman down here in a wheelchair, and it was like how accessible something that is available to so many other women is still not there, and we're living in the year 2022. This was just kind of an overview before the video. This is where the part where I shift to self-advocacy, because, I've shared a lot about my perspective of disability and wellness, how I've had my own personal injury, how it's played out in my life, what I've created in order to ensure that there's been some sort of change in the world associated to that. What I don't want to take light away from is that we all should remember that we have to be self-advocates for ourselves in the healthcare arena. And there are many, 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 many stories where, because we know our bodies so well, and when there's a difference between self-advocating and somebody calling us a difficult patient. And that's when you as individuals, I hope will be able to distinguish between those two. If you're advocating and you want to be able to express your opinion, that's okay. Every patient has the right to advocate for themselves. If you know that you're being calm and collective, at the same time, if you've got to raise your voice a little bit to say, hey, you're not listening to me, please listen to me. Know that as soon as you're staying within those boundaries and they start to call you a difficult patient, start to recognize that you're not a difficult patient, that you're advocating. And a lot of physicians and healthcare providers are not always welcome to people being self-advocates for themselves. Many of them support it, but not everyone does. And so I just wanted to put light on that for situational pieces, but also put light on that as power that all of us individually have the ability to be self-advocates and do small work just for ourselves, as well as large work for others. Like if I'm able to do systemic change, anyone, and these integrative therapies, acupuncture, massage, and chiropractic, available under Medicaid, can literally happen in any state if an advocate in that state wants to make it happen. And our organization has thought about, well, how do we go state by state and do that? In reality, we've been trying to foster, how do we get advocates in those states to go and represent that service for that population, because it deserves to be available to everyone. Back to the whole piece around maintenance, from no mobility to any level of function, and allowing your body and giving your body what it deserves so that it gets to make the best decision about what it's able to, how it's able to function with that support. So with that said, I wanted to give some time for conversation, questions. I know that I'm giving a little bit more time than normal, but I do feel that there could be some healthy discussion in this area just because it's such a large topic, and I only have really grazed at the top of grazed the conversation and the topic. So I would love to shift to that if we could do that.
Of course, thank you. That was some great information. It's great to know what all the work that you've done and what your center is doing. And we do have one question that says, you have such a good point about mammograms. What about gynecological exams and accessible tables? Does your center offer that, as well as education about how female health is different with an SCI?
Yeah, so with our primary care physician, so we do have tables. One of the things that we don't have a mammogram here, but to answer your question, we do have adjustable tables. We do have the tables that have the very, very specific sort of boots, not the stirrups, because we provided education to our provider that with spasticity and bone density, as well as muscle like contraction, like we didn't want a physician ever causing more harm. So we have provided our physician education to go beyond our physician, because that's just one physician in one building. It doesn't go beyond that, is that we built what's called an educational platform for primary care physicians, where they can go online and educate themselves. So that way more and more of this education to, and it's not even primary care, it's emergency room physicians or MAs, it's the whole back office, but that they're getting educated as well. And we've even got the products on there to say, hey, this is the kind of table, this is why you would choose this table, but here are the techniques outside of transferring them onto the table. Obviously always checking in, because we're all different, right? But at the same time, being able to be aware of some of those pieces before you go in to the room. You should know that as a physician.
Thank you. We have another comment. It's not a question, but I'm going to turn it into a question. There's a comment that says, I feel I get minimal care. It's been 33 years since my accident. With all the surgeries I've had, they don't suggest things I could do to help me, only just to cope with how I am. It's very sad and discouraging at times with how they treat me. I want to do more. I'm independent, and it would be nice if they worked with me better and were open-minded with offering other options. So what would you say to someone who's in a community that, your center is obviously very specialized, and, if you're in a community where these resources aren't available, like how can someone become an advocate for themselves, or what can they do?
Yeah, so the first part of that thing, the first part of your comment that I want to speak to is that you're absolutely right. It's extremely devastating. And I even thought about that, where I've often have spoken to physicians, because with this educational platform, I've sat down with them and I've said, like, why haven't you recommended other things? And there for the longest time, I was more frustrated with them, and then I had a slight bit of empathy, but not for too long, because then that's when some other things could happen. But one of the things that they did mention is that, well, Chanda, I never would have mentioned acupuncture, because as your physician, had I mentioned to go do acupuncture, how were you going to just pay out of pocket for it? Because at that time, the Colorado Medicaid didn't pay for acupuncture. You went to the legislation and made that happen. So I think that there are times where physicians, good physicians and providers, get caught between what they would really love to recommend and what's truly covered by whether it's Medicaid or other insurances. And so oftentimes what physicians have shared with me is that then they've stopped to serve that population because they don't want to be the constant bearer of bad news that, well, normally I might recommend this, but I can't because then it's a dead end for you. And so I had never really looked at that side of the coin before. And so now I'm more aware of that. And so as I work on, legislative work, I do bring the physicians into the conversation, because then they're the people that testify and say, yes, this person deserves this. And if I can't, I won't recommend it if I know that it's not going to be of a resource that's covered, right? Now, for those that can financially afford it out of pocket, I still said to them, hey, it's still worth telling them and just being very direct about that you're not aware of whether they'll have coverage around it, but knowing, their lifestyle, their diet, like asking those questions is really important, because and sometimes they don't even ask it of people that have spinal cord injuries. And so that's the hard part, right? Like my sister may go in and see a primary care, which is very few and far between, but when she has, they've asked questions that were nothing about her health. She's like, I just went in there and it was about, well, let me give you this, this, and this, and this, and you're out the door. It was nothing about there being collaboration around the healthcare or even addressing the healthcare. So I really, really encourage, I'm so hoping that one day we can see, the waiver that's here in Colorado being passed and being created in other states, because it would really, really open up a lot for folks with spinal cord injuries and women with spinal cord injuries to access these services.
Yeah, and can we talk a little bit further on that? You mentioned something about, wanting to expand that state to state. What if there was someone who really wanted to champion that in their state? Like what could they do?
Yeah, so what we've done is we've put together a little bit of a playbook. So we have a manuscript, lack of a better word, where we can give you kind of a roadmap that says, like, this is what we've done. This is how we've angled certain things. So anybody that's on this call that is an advocate that wants to be a part of that, of course, we would be able to hand over that kind of information to you so that you can roll with it. I know that we as an organization will be of technical assistance to organizations in other states that want to do it without any cost, just because we believe that it needs to happen. We're not going to charge people for having, wanting to do the right thing, going out there and doing it. I encourage people to always reach out to, their senators and their representatives, depending on the legislation and how it's set up in your state, to say, hey, I'm an individual or I'm with an organization. We don't have the money to pay for a lobbyist. Do you know any lobbyists that give a portion of their work as pro bono? Because we've been able to do our work all with a pro bono lobbyist. And had we not had that, I don't know how successful we would have been. And it was just knocking down a lot of doors and just saying, hey, this is the right thing. And we need people to be savvy so that way we can get this through.
All right, you heard it, ladies, on this call. We need your help to expand this all over the country. We have another comment from Monique about the Raw Beauty Project, the health initiative that provides advocacy and education for women with disabilities as well. So yeah, please check that out, the Raw Beauty Project. Any questions? Please continue to add questions. Otherwise, I'm just going to keep asking my questions. And if you do feel like you'd rather speak your question, please just do the raise hand and I can unmute you. Okay. We have another comment. Let me just read that really quick. Oh yeah, it's talking about, mammograms in different machines. I know that is just like a big issue for many women all over the country. Do you have anything to add to that?
Yeah, I was just reading about, I was able to sit in the chair. I was able to lean forward while one person held me in place while the other took the scan. Um, the hexagon, the 3D machine can accommodate a manual and can adjust as its height. So I guess is that just around a manual chair versus a power chair? I think yeah, I've tried from a power chair, and it just continues to be an issue. I think one of the biggest things too is that we had one of our acupuncturists who got her PhD, and one of her projects was to find out which OBGYNs actually accepted Medicaid, which was right now in the Denver metro area, there wasn't any that was accepting Medicaid. So that was really interesting because I think that right now what we have is a lot of primary care physicians doing what we feel would be best set for an OBGYN, right? But I think because of lack of coverage, that's what is occurring. But her research and what she found, and just providers having this really interesting, like it out of sight, out of mind sort of thing. So if they don't have to serve that population, then they're not aware of it, which means that they're not not doing anything negative to not make it available, which in reality is just kind of a way for people to avoid. Because another physician that was really open about all of this, she said, I went into medicine to change people's lives and to make them healthy. And what has gotten in the way is the insurance companies not allowing me to practice medicine. And so I think that was very interesting and telling, where they've got, in order to make some sort of living, which at the same time I was like, well, you make a pretty good living. So that's another question, but she did say that there are some physicians that will make decisions based off of profit, obviously, knowing that when they first were there in MD school, they were just so excited about changing and impacting lives. So it's really interesting to see how that shifts as they get into practice and start understanding what takes more work, what's going to be paid for. And medical school isn't cheap, so I get that as well. But that was a long answer to that question.
We have another really good question. It says, do you have real world data that you collect from participants in your program about health outcomes compared to others who do not participate, or health outcomes prior to treatment and post-treatment? And also, how have you used the data to advocate for support?
Yeah, so we do collect our own data, and then the Medicaid, which it used to be called the spinal cord injury waiver in Colorado. It's now the complementary and integrative health waiver, because I told them that I want them to stop naming waivers after disabilities. Not everything, like, let's not name it after our disability. It's like, because there's the brain injury waiver, the spinal cord injury waiver. I'm like, name it after the service. That feels better. And so of those two, there's an independent evaluation as well as our own. Ours isn't probably as sophisticated as theirs, but every 6 months, those that are on it get a very specific, it's like a very specific research questionnaire that it's the same one every time. So that way, one of them is that we want to meet particular satisfaction. So we want to make sure that we're making a percentage satisfaction with our participants, but then we also want to look at from this month to, or from 6 months ago to this 6 months ago, where does our data live? Because we want our data to always drive the change in our programs. We don't want to just make change without data. And so with that, the evaluation that's with Medicaid, they go into far more detail. So they are comparing other waivers that have folks with spinal cord injuries on those waiver. Like, so in the state of Colorado, they compare the elderly, blind, and disabled waiver against the integrative, complementary and integrative health waiver. And these are folks that don't get acupuncture, massage, and chiropractic, and these are folks that do. So they're comparing those two pools, and then also watching the data by going into these folks and saying, okay, in their claims, how much are we spending on these folks? Are they taking more medications or less medications? Are they going to the hospital more or not? Are they are they using more physician visits? There's all these kind of metrics that they look at to see, well, if we're sustaining better health, a lot of those costs should start going down. And so they follow the claims in order to determine the improvement over here, as well as the comparison of the two. And so that's a pretty significant one. We as a grassroots organization are just really ensuring that our participants are happy and satisfied with the services being delivered, knowing that that side evaluation is going to be actually concrete data that we can start, putting into, having it pre-previewed and putting it out into our those sorts of things. And so we're excited about that data, and it's been being collected over the last 10 years. So that's really exciting as well.
That's great. And I hope to continue to see, that shifting, so that hopefully it'll happen in other places. We have one final question. Other than the helpful services that you are finding ways to get covered, have you noticed anything or any problems that are now showing up within the SCI, aging, or disability community? For example, bone density.
Yeah, I know that aging with a spinal cord injury is real, and I'm sure that there's a lot of folks on the call that are just like, I find that one example would be that they are now telling us that, because so what they do is they do studies on all the medications, right? We're in a time, and they do studies about what's happening at this time. And then at this time, everything that was happening here, now we know more results about, right? So that's the whole prolong of the studies with spinal cord injury and aging with a disability. So I recently went to my urologist, and the urologist was like, oh yeah, the studies show that that our oxybutynin is causing early onset dementia. And I looked over at him and I was like, I said, what? And he said, yeah, the studies show that and I go, so the thing is what's so frustrating about us and women with disabilities is that what we do now, we're never going to know the impact until much later. Like when I was 9 years old, I had a super pubic put in. Because I'm a quad, and not just, but like 5 years ago, well, they, indwelling catheters increase your chance of bladder cancer, and because of so these are just scary things that continuously are brought up to us, that there are no choices that we can make outside of those, because we have to pee, we have to have, when we have a neurogenic bladder, we have to have it relax. Like there are things that we just cannot get away from. And I think that one study I would recommend some of you looking at, and I'll make this short because I know some of the time is getting close to being up, is that not the Christopher and Dana Reeve, but it's called Shriners Hospital for Children with Spinal Cord Injury. They have a very, very large study on spinal cord injury aging. And so I've been in it since I was 13. So I've been inside the study.
There's the same study too.
Yeah, isn't it cool?
Yeah.
And they're starting to they're showing a lot of really great data, like to show some of the common things that are starting to come up based on the year that you're injured, but also based on your age and the year, how long you've been injured. And so it's really fascinating. And I just go to a place of like, I've got to make this fascinating, because if I go to any other place, it'll just make me too sad because I'm all like, oh, great. What am I taking today that's going to make me, not this way 10 years from now? So I hope that answered your question, but I think that it's an ever moving target and we've got to keep bringing that data forward.
Well, thank you so much for, I think I'm back on the screen, but thank you so much for sharing all of this. This was amazing, an amazing conversation and like really informational. We will be sending out this recording for those who had to leave a little bit earlier, or if you want to rewatch it, or if you want to share it with your network, please do. And please check out our website in the next couple of weeks. We're halfway through the year and through this program. And so in the next couple of weeks, we're going to be posting our upcoming webinars for the second half of the year, which happen every second Wednesday of the month. And then on the fourth Wednesday is when we do our small groups. So if you're a woman with a spinal cord injury, or you know of someone that you would like to recommend this to, please do so. I'm adding these to the chat right now to find more information. Our YouTube channel, our survey, if you don't mind filling it out, please. And then how to join our small group discussions. Chanda, thank you so much. I appreciate this conversation. It's always nice to talk to you. And it sounds like a lot of the comments in the chat is that a lot of thank yous and feeling a little bit empowered, they say. So I hope everyone has a really good night and please join us for next month. Bye.